That is the thought process they're using. This is why it's sometimes challenging for us to get to the 99205 level, because when we look at that table of risk, we're talking about TIAs, strokes, major trauma, head injuries, loss of consciousness, bleeding out, and massive trauma. So typically that's not what's walking into the primary care doctor's office, and so the 205s can get harder for us to get to. Luckily though, we also get to count our chronic stable illnesses. So where we do fall into these more complex visits is with like a 99213. Some examples of what low risk means in their world is one acute uncomplicated issue, i.e. this URI that we're using in our example. 2 or more self-limited problems, 1 stable chronic illness, whether or not you do over-the-counter meds, minor surgery, or you refer them out for PT. Those are examples of what are low risk in the conventional realm. A 214 is moderate risk, meaning you have 1 or more chronic illnesses with a mild exacerbation, 2 or more stable chronic illnesses, which is many of us. We're seeing someone with RA and hypertension, or hypertension and high cholesterol, or allergies and hypertension. So 2 stable chronic illnesses, we typically fall into this moderate risk pretty easily. An undiagnosed new problem with an uncertain prognosis, i.e. you find a breast lump and you don't know what it is and you're going to need to order testing, or an acute illness with systemic symptoms, a UTI with back pain and fever, it may be going to pyelonephritis, so that's going to be systemic symptoms, or you're handling prescription medications. Depends on what state you're in for that one. With this example, with the URI and allergies, depending on what we do with our treatment plan, you could easily justify a 99214 with good chart notes. Now granted, we already did that with our history and physical. With the medical decision making, we could do the 214 if we are managing the allergies. We're giving them, maybe you gave them a Z-Pack, maybe you didn't, and you did an herbal compound, plus you're telling them to do other things for their allergies. And even if your treatment plan only got you to the 99213, the visit overall, you still get a bill out of 214 because you've met all the criteria for the history and physical, because you only have to meet 2 of the 3 criteria for an established patient. So we don't have to make things too complicated to actually bill out a reasonably good paying visit. So let's look at these couple of sources that I've been referencing so that everyone can get on the same page. You also got these emailed to you, so I have to get to that one. So the first thing, let's look at our E&M audit tool. So this, remember, is an example of an audit tool from one insurance. Other companies might use something slightly different, but they're all going to kind of follow this gist. So here is our history section. So our history or history of present illness, remember, is going to encompass history, review of systems, past family social history. Here's our 7 or 8 attributes. If you do only 1 to 3 of them, that's going to correspond to a 212 or a 213 or a 202 if it's a new patient. We'll get to new patients in just a minute. If you do 4 or more of these bullet points, then you have a 214 or a 215. So it's considered a detailed or comprehensive history. Review of systems, quite easy to get to the 214. 2 to 9 systems of any of these 10 over here. If you want that high-level visit, though, you got to hit all 10 systems. This is where, especially for a new patient, you'll see 204s fall over into this category. If you have someone who's doing an intake with all